morning, y'all.
Good morning.
So, ordinarily, I'm a woman of few words. I am an introvert by trade, and a nurse by trade, like Miss Mayor here. So, I am just going to talk to you guys about our partnership with Chriselle and Miss Gerald and Big Picture Learning and South Carolina Do. In September, we were presented with the opportunity to have students come on board and for our Power Ed grant. And I was like, sure, we have students all the time at McLeod. We love students, high school, college. You come on board, and everybody thinks about a hospital. They're saying, what do you think about what's the first thing you think about when you think about a hospital? Blood. Healthcare. But what about healthcare when you think about the jobs? Nurses. I am one. I love being a nurse. And doctors, right? What do our students not think about? All of those things that help to make it an operation and to support nurses and doctors, right? And so at McLeod, we are a little city within a city, right? So everything that it takes to support Florence, we tell our students, it takes to support McLeod. And so we have a warehouse, we have a CSC where all of our supplies go from all of our 8 hospitals from one warehouse. We need people to work that. We have plumbing, engineering, electrical, HVAC, all of those things, because we do that in-house. And so when Chriselle came along, we were like, yeah, we can do an engineering program for some students, 12 students. And so those students are coming on board. We're starting our program up and getting it ready to run. But first of all, you have to ask permission of those people who own those departments. When we went to Emily Lacera, who is the VP of Engineering at McLeod Health, she was like, students, are you serious? Because I am, as she said, I'm the Director of Recruiting and Workforce. And so I know the vacancies that we have. I know how hard it is to get individuals who are highly trained, ready to do that work into the workforce. And so, as it's been reiterated probably 100 times now, we have to start middle school and high school. We have to teach them that these are lucrative jobs, and they are jobs that you're valued in your job. I will give you an example of when this was so valuable to us, the HVAC engineering team, when we had Hurricane Matthew and the ceilings were coming down because the wind was so high and the water was coming in and patients didn't have AC, the generators were going, we didn't have water. They were the cavalry. Engineering was the cavalry from McLeod. When we would see those guys in those green uniforms come in with the plumbing stuff, we were like, yes! Nurses, we were no longer the heroes. So we were like, we need you. And the patients were like, is he coming? They were looking for the man with the cap. And we tell that story to the students. You're heroes every day to these patients. If your toilet doesn't flush, that's a problem. If there's paint peeling off the wall, that's a problem. We need to be aesthetically pleasing and clean. And we need to have all of those things, and it takes all of us as a team working together to do that work. And so when those students come on board, they know that they are a part of a team, that they are linking arms with nurses, doctors, techs, radiology folks. We can't do it without them. And so we're excited about having those 12 students come on board. They will be doing HVAC, construction, plumbing, and electrical work, hands-on training. And of course, there's financial perks to that, but the part that they're going to get is the experiential learning and being in the field and doing that work with their hands. I love that you said it's about doing the work with their hands, and they're doing that work with their hands. And we are so happy to be partnering as McLeod Health with Big Picture Learning and South Carolina Do to do this work. And if you guys have any questions about how we're doing it and what we're going to do going forward, please don't hesitate to reach out to me, Charity Gerald. Thank you.